You're watching Fox 40, news that matters.
And diagnosing sleep apnea, for many it goes undetected for years. But if you wake up feeling tired after a night of tossing and turning, suffer no more. The at-home test you can take to determine if you might have sleep apnea.
Turning to your health matters this morning, did you know 22,000 Americans have sleep apnea? That's the latest statistics, alarming numbers. 85% of those people don't even know it. So joining us this morning is Dr. Suzanne, author of Snoring, the Clue That Can Save Your Life.
Yes.
Those are pretty alarming statistics.
Yes, it's crazy because so many people have it, but so many people are completely unaware that they do. Unaware.
Sure. Because they're asleep.
Yes, they're asleep, exactly. And so what sleep apnea is where you're gasping, choking, and suffocating your sleep. You stop breathing while you're sleeping. And so imagine that when you don't breathe, you're going to increase your risk for heart disease, diabetes, heart attacks, strokes, depression, and even death by car accident. You know.
Okay, on a basic level, breathing is necessary to be alive as a human. So you've brought several things to help detect whether or not you have sleep apnea. Tell us about this.
Yes, and so, you know, if you have sleep apnea, if you have, you know, any of those things, there are definitely signs and symptoms. And so to find out if you do, you have to do a sleep study.
Okay.
And so you have options. You could go to the hospital sleep lab, be strapped to a bunch of electrodes, and have someone watch you while you sleep.
Okay, and so that's what you've brought here?
Yes, well, that's one way. That's to find out. But then you can do a home sleep test. This is my Aries home sleep test device. It's perfect. You can take it home, use it in the comfort of your own bed with no electrodes, no one watching you.
What is it detecting? What does it do?
It'll collect data overnight. It's trying to see how many times you stop breathing during the night. It measures oxygenation levels and how low it gets.
By just sitting on your forehead?
Yes, there's electrodes behind there.
Got it.
But it's just right there, and then you have a nasal cannula that comes into your nose. But that's it. But you get to sleep in your own bed.
And what is this?
And so if they find out you have sleep apnea, you can use a CPAP machine, the way Shaquille O'Neal or Rosie O'Donnell do. And so it comes over your face. So yes, there's a bunch of straps and there's a bunch of straps and a mask, and it will give you continuous airway pressure so that you can breathe. But then a lot of people cannot handle this because they feel like it's claustrophobic, they don't like the straps, you know, they feel embarrassed when they go to bed when they're sitting next to their spouse.
Dr. we got to move this along because we want to get to the question here. So what is this?
And so this is an oral appliance. Now this is an option many people are not aware of. When you can't do the mask, then you can do this oral appliance. It's comfortable, it's convenient.
And helps you breathe.
Yes, well, it will remove the tissues, kind of move the tissues out of the way so that you can breathe, and it's going to save your life.
All right, let's figure out if people do have sleep apnea or not. There's a quiz that people can take. Go through some of the questions, please.
Yes, some of the questions. Number one, do you get drowsy or tired while you're sitting and reading or watching TV, or maybe sitting in a public place like a theater or a meeting, or while stopped at a stoplight or a stop sign?
Right. Well, a lot of people do that and maybe don't have sleep apnea. So what are some of the other questions as well?
Some of the other questions. Do you snore? Because what happens is the tissues in the back of your throat start to cover up that airway, and when it partially covers it and the air goes in and out, the tissues start to vibrate and cause that snoring sound, but eventually it completely covers it, and when it does that, that's when you don't breathe. That's when you have sleep apnea.
All right, let's get through one more question.
Yes, and then question number 3, do you have high blood pressure or heart disease? Because when you don't breathe, you're not getting oxygen to your brain, and so then the heart has to compensate for that. It'll beat super fast, and then it will, you know, when it's beating super fast, then it's going to cause an increase in blood pressure and heart disease.
A lot of great information on finding out whether or not we have sleep apnea and getting the help that we need. Dr. Suzanne, thank you so much for being with us this morning. And again, the author of Snoring, the Clue That Can Save Your Life.
Yes, ma'am. Thank you.